Hello everyone, this is Linda Emanuel with Alternative Revelations. And this is the big one. This is podcast number 60, an interview with Dr. Jim Taylor, a stem cell researcher and an alternative doctor who is helping many people get well. And there are two parts to this interview. The first part is about stem cell therapy, and the second part is about mild silver protein and mycoplasma, the most common cause of cancer and disease. And usually I put this disclaimer in, but since we have a doctor on board, I usually say this podcast is for informational purposes only. I am not a doctor, nor can I give medical advice. And again, but he's with us, and I wish we had a live chat that he could answer questions. But you're going to get a lot of questions answered with this podcast, and I really do believe it's going to be worth your while to listen. And first, I'm going to introduce Dr. Jim Taylor, who's sitting right next to me. He came up from Savannah, Georgia to do this interview, and I'm just so honored that he did this because he's a very busy person, and he travels all over the country helping people get well. And instead of me introducing him, Dr. Taylor, I'm going to let him introduce himself. So good afternoon, Dr. Taylor. It's so nice to have you here.
Thank you, Linda. It's a pleasure to be here. I'm a stem cell research physician, and for the past 19 years have conducted some 72 human clinical studies utilizing the patients on stem cells as a treatment protocol in these clinical studies. And over those 19 years, we have treated over 8,000 patients and have performed over 2 million treatments utilizing the patient's own stem cells for various and sundry conditions. The human stem cell clinical studies I alluded to earlier include, but are not limited to, anti-aging, autism, Alzheimer's, COPD, cardiovascular disease, dementia, lupus, Parkinson's, diabetes, neuropathy, regeneration of torn meniscus, ACLs, rotator cuff tears, disc degeneration or disc regeneration in the spine, and facial rejuvenation, just to name a few.
Now, just for your curiosity, Dr. Taylor is going to tell you a little about his educational background.
I have a DC degree, which is a Doctor of Chiropractic from Life Chiropractic College, an MD degree from the School of Medicine of Santo Domingo, Dominican Republic, a Master of Science in Law from Southern Cal, and a PhD in Physiology from the University of Mexico, Cancun.
Okay, now this is going to turn into a Q&A. I am going to ask Dr. Taylor about stem cells. And the first question, Dr. Taylor, is, where are stem cells made in the body?
Stem cells are made in our bodies in the bone marrow. And from the time we are conceived until the time we check out of here and move on to other dimensions, whether it be heaven or hell or some other dimension, stem cells are regenerating our bodily tissues and organs from the beginning to the end.
And the next question is, what are the functions of stem cells?
The primary function of stem cells is to regenerate the different cells, tissues, and organs of our body, and to keep those particular cells, tissues, and organs functioning to the optimum for as long as humanly possible. To say the least, stem cells are specialized cells, and by specialized we mean that stem cells have the DNA matrix of every cell in the body. Stem cells are capable of regenerating and reproducing each and every cell in our bodies, whether it be eye tissue, heart tissue, lung tissue, liver, kidney, nerve. If you can name it, a stem cell has regenerated it.
So when stem cells are made, where do they go and what do they do?
As we said earlier, the body makes the stem cells in the bone marrow. And from the bone marrow, the stem cells travel through the body via the circulatory system to all areas of the body. And as they travel, if there are tissues or organs that need repair or need additional help, those particular stem cells differentiate into that particular stem cell, into that particular cell and tissue, and take on its function. And by doing so, those particular stem cells help maintain the normal function of that particular tissue or organ, which in turn assist in maintaining a certain level of health. Stem cells are also stored in adipose or fat tissue for later use if needed. So having said that, there are 3 areas stem cells can be extracted or harvested from the body. The first one is you can aspirate the pelvic or the tibia bone and harvest stem cells. Secondly, you can aspirate adipose or fat tissue and harvest stem cells. And lastly, and I consider the most important, is that you can do a venous draw from a vein and harvest stem cells.
So, Dr. Taylor, it sounds like you really like to do this venous draw. What is the advantages or the reason why you prefer this?
Well, aspirating the pelvic bone and the tibia or aspirating adipose tissue are all much more painful procedures than a venous blood draw. And after the 3rd or 4th aspiration of your tibia or your pelvic bone or fat aspiration, you're going to develop what I would consider a dislike for your doctor. So we have developed a methodology whereby we can pull venous blood from the arm or hand, or any vein for that matter, and harvest 90 to 95% of the stem cells that are in the venous blood. We've also developed a methodology of reintroducing the stem cells back into the patient that is presently patent pending and is primarily utilized for the treatment of neurological, systemic, and organic conditions. An example being diabetes, neuropathy, and COPD, just to name a few.
So, Dr. Taylor, my next question is, what type of stem cells are utilized for treatment?
One of the most important issues in dealing with stem cells that I think an individual or patient should consider is the type of stem cell they are considering in their treatment. There are 4 basic types of stem cells that can be considered and are utilized for stem cell treatments. They are embryonic stem cells, which are taken from the egg of a female, umbilical cord stem cells, which are harvested from the umbilical cord of a newborn baby, donor stem cells, which are harvested from a close match of the recipient, and adult mesenchymal stem cells from the patient's own body.
You know, this is new territory for me, but this is really fascinating that you can regenerate tissue. So my next question here is, when were stem cells discovered?
Stem cells were discovered in human cord blood in 1978. Martin and his group derived mouse embryonic stem cells from the inner mass of a mouse embryo in 1981. And so scientists discovered ways to derive embryonic stem cells from early mouse embryos almost 40 years ago in 1981. The detailed study of the biology of mouse stem cells led to the discovery in 1998 of a method to derive stem cells from human embryos and to grow cells in the laboratory. A lady named Gail Martin, who at the time was with the University of California, San Francisco, is attributed to coining the term embryonic stem cell.
Well, you know, again, this is fascinating. I have a lot of questions of my own. And are there any problems with the other types of stem cells being used?
Well, the answer to that question is yes, there are, and have been. One of the initial problems with researching and harvesting embryonic stem cells, especially for pharmaceutical companies who have funded or seen that embryonic stem cell research was initially funded, was that of a moral issue, similar to Roe versus Wade, if you're familiar with that court case. And similarly, the stem cells from embryos could not be utilized without sacrificing or killing, if you will, the embryo. This became and still is such a controversial issue that it caused the pharmaceutical companies to place embryonic stem cell therapy on the back shelf, at least for the time being. And now the pharmaceutical companies have embraced umbilical cord stem cells.
Okay, this leads up to my next question. With tissue being rejected because it is not your own, isn't there a problem with using umbilical stem cells?
I believe that there's a number of problems using umbilical cord stem cells, as well as the embryonic cells. For a number of years, a market has developed where, after a baby is born, the parents are encouraged to keep the baby's umbilical cord in an umbilical cord blood bank. And for these umbilical cord blood banks and the pharmaceutical companies, this has turned into a lucrative business, a multi-billion-dollar business. But cord blood has been used in transplant medicine for over 30 years and has been used in the treatment of nearly 80 diseases. What hasn't been done is that there has been no major consistent follow-up for the patients being treated with someone else's cord blood to determine any adverse reactions. That's not to say that there hasn't been some follow-up. What we are saying is that there hasn't been enough follow-up. And as of 2019, cord blood therapies are the only FDA-approved stem cell-based therapies in the United States. These cord blood therapies are currently limited to treating patients with cord blood disorders.
So I'm understanding that the FDA only approves cord stem cell therapy, so you cannot use your own stem cells from your own blood?
At the moment, that is correct. The FDA has only approved cord stem cell therapy, and they have not approved utilizing your own mesenchymal stem cells.
So basically, if somebody wanted to get stem cell therapy and use their own stem cells, they would have to go to an alternative doctor like you or somebody else that's familiar with this procedure.
That's correct. They would have to go to either Mexico or Germany or Costa Rica to get mesenchymal stem cells from their own body, because, as I said earlier, the FDA has only approved umbilical cord stem cells for treatment in the United States.
So, this sounds like a little bit of a money scam with the pharmaceuticals, that they have the monopoly on cord umbilical stem cells, and they're keeping people from making choices about stem cell use. And it's just a typical, just all over the place with the pharmaceuticals, very powerful, and we need to get our medical freedom back. And this has been really interesting. We're going to keep going here, and he's got a lot more to say about stem cell therapy. And also, I'd like to point out that from what I've understood or learned, that when people get like kidney transplants, they're on this real expensive medicine the rest of their lives to keep their bodies from rejecting these foreign cells. What do you think about that?
Well, anytime that you use a foreign tissue, whether it be a kidney transplant or a lung transplant, or even using donor stem cells, there's going to be a natural rejection of the patient's body for those tissues. That's why there's donor stem cells that are harvested from a match, and a match being someone that has similar blood type and DNA makeup as the patient. And let me just give you an example of a stem cell transplant that you may be familiar with. Robin Roberts, one of the hosts, I guess I should say hostess of Good Morning America, was who underwent a bone marrow transplant with stem cells from her sister Sally in 2012, as Sally was deemed a match for her sister Robin. Now, make no mistake, in Robin and Sally's case, and in hundreds and thousands of others, there may be similarities in the DNA makeup and in the blood, especially of their relatives, whether it be mother, father, sister, brother, cousin, aunt, or uncle. But make no mistake, and no one, let me re-emphasize, no one on the face of this earth has the same DNA matrix as someone else, not even identical twins. So the minute that so-called matched donor stem cell DNA matrix is introduced into your body, your immune system is going to recognize it as a foreign tissue. Your immune system will immediately start producing antibodies to fight and kill those intruders, because that's what your immune system is supposed to do. But back to Robin for a moment and her issues with the donor stem cell therapy from her sister Sally. Since the donor stem cell treatment from Sally to Robin for the last 7 going on 8 years, Robin has had to take immunosuppressant drugs to prevent her immune system from not only rejecting Sally's donor cells, but also to prevent Robin's immune system from attempting to ward off what Robin's immune system would consider foreign invaders. So from the time Sally's stem cells were introduced into Robin's body, Robin's immune system, even though it was supposedly rendered unable to ward off Sally's stem cells because they are foreign tissue, and by Robin's immune system still considering Sally's stem cells foreign invaders, Robin's immune system will never openly welcome Sally's stem cells into Robin's body. So till the day Robin Roberts passes from this earth, Robin's immune system will consider or will continue to attempt to thwart off Sally's stem cells because they're foreign tissue. And the same goes for anyone else who undergoes donor stem cell treatments or organ transplants.
And these drugs are expensive, aren't they? They're about, I've heard, $500-600. And so let's say there's a crisis, an economic shutdown, and these people can't get their drugs. They'll probably die, I'm assuming, because their immune system will go into like a cytokine storm or something like that, or big rejection. What would happen if the body does not get those drugs?
It's pretty simply stated, they'll expire.
They'll die?
Yeah.
So since you're a doctor and you can give some medical advice, I'm not asking you to stick your neck out on the line. So let's say I would need a kidney. And would an option be that I could get stem cells to help regenerate my kidney? Would that be possible?
Well, depending on the case and depending on the severity of the condition of the kidney, the question that you're asking me, it's very possible that the condition that is giving the person a problem with their kidneys could be taken care of with stem cell regeneration. And again, it's going to depend on the condition and the patient's overall health, and whether or not you use the patient's stem cells, you use donor cells. So there's a lot of variables in the question you just asked me.
So in your clinic in Mexico, you really go over somebody's records and you check everything out thoroughly. So they do have choices they can make about life and death, because you can't live without a kidney. And I know somebody that has had a kidney transplant, and they wish they would have just kept getting the, what do you call it? The dialysis, yes, and they got the transplant and they're all bloated up and they're just so sick they're near death. I'm not telling people to not get a kidney transplant. If your life is on the line, you have to listen to your doctor's advice, but you also have to make your own choices and do research. Research this. Just don't take our word for it, Dr. Taylor's word for it. Do your own research, make your own choices, come up with your own conclusions. So I'm going to go on to the next question. So this is my take on it. What you're telling me about the pharmaceuticals is that the pharmaceuticals are pushing the umbilical cord stem cells because they're from a fresh newborn baby, and your stem cells are too old to regenerate your tissue. Do you have an answer for that?
Yeah, this is one of the major selling points that Big Pharma uses to sell umbilical cord stem cell therapy. And I think it's a pretty good sales pitch, because they say that umbilical cord stem cells are much better since the stem cells in the cord blood haven't been exposed to potentially harmful factors impacting stem cells collected later in life. And by saving the pristine cells moments after the baby is born proves to be invaluable medical resources for your family and for your future, or for anyone else's that utilize umbilical cord cells. I would say that is a quite convincing sales pitch. But if you know nothing about DNA, and if you know nothing about cell regeneration or tissue regeneration or female horse urine, female horse urine is used for pharmaceutical companies to make synthetic female hormone therapy for women. And I'm not talking about women horses either. But here's the bottom line. If you receive stem cell treatments from another stem cell other than your own, from the moment these foreign stem cells are introduced into your body, there's a constant immune response by the body against the newly introduced foreign tissue. And in this case, we're talking about stem cells. And the constant immune response slowly damages tissues and organs that are or were affected by those foreign stem cells. Now, if you will take into consideration the fact that stem cells you have in your bone marrow at this present moment are not the stem cells you had when you were born, nor are they the stem cells that were in your body last year. And some stem cells were not in your body 6 months ago that are there now, or even 6 hours for that matter. Which means you have stem cells in your body that are new, fresh, and much more potent and newer than any stem cell you're going to get from a donor stem cell or an embryonic stem cell or from an umbilical cord stem cell, which may have been harvested from an umbilical cord that was frozen for the last 20 years, because you don't know where that umbilical cord was harvested or when. And because you may have an abnormal condition going on in your body, or even a disease condition, does not mean that your stem cells are also affected. In most cases, it's the contrary. And if you utilize your own stem cells, they are designed to regenerate and take the place of abnormal and diseased tissue with normal and healthy tissues. So think about this for a moment. That's the job of the stem cells. That's why they're in your body. And with no side effects and no need of immunosuppressant drugs that you will be required to take the rest of your life if you use embryonic donor umbilical cord stem cells. So if you use a little common sense and think about this for a moment, it's in the best interest of the drug companies to promote umbilical cord stem cells and donor stem cells. The drug companies process the umbilical cord stem cells, sell them to you, and once you've taken them, the drug companies get to sell you immune suppressant drugs the rest of your life. So for the drug companies, it's literally a win-win situation. That's why at the moment the only FDA-approved stem cell therapy in this country is umbilical cord stem cell therapy. And until the drug companies figure out how they can pull your stem cells from you and then reintroduce them back into you and charge you for it, adult stem cell therapeutics will be ostracized, blackballed, blacklisted, shunned, snubbed, left out in the cold, and you will be hearing cockamamie excuses like your stem cells are too old or your stem cells aren't fresh. Your stem cells don't have the potency of an umbilical cord stem cell. I call BS on that.
So let me get this straight. I have another question. This is my own question. Does a 90-year-old person have the same amount of stem cells as a 10-year-old?
Well, you kind of went to extremes on me from 10 to 90. But as I said earlier, when at conception your body starts producing, or the fetus starts producing stem cells. And you continue to produce stem cells in mass from the time of conception until you're about 30 years old. Somewhere around 30 years old, the stem cell population kind of levels off till about 40 or 45. And then as you age, stem cell production population in the bone marrow lessens. Now, one of the clinical studies that we performed was, do you age because you produce less stem cells? And if so, if you produce more stem cells, can you reverse aging? We believe that we came up with some answers to that question.
So I have another interesting question, and this is going to be easy for you. So let's say I cut myself. So the stem cells in my blood are the cells that are used to regenerate, or not regenerate, maybe to repair that injury. Is that correct?
That's correct.
Okay, can you get into a little bit about telomeres? Does that make a difference about aging and when you cannot regenerate your injured tissue anymore? Or let's say you have a degenerative disease like macular degeneration. So once the telomeres fall off, you can't regenerate the tissue anymore. Did I make that kind of clear?
I think so. Let me see if I can answer that question. About 4 years ago, Stanford University performed a clinical study on correlating the age of a patient or a person to the length of their telomere. And what they did is, you may be 60 years old, and your telomere length may correlate to you being 50 years old, making you younger than 60. Or you may have a shorter telomere length that says that you're running 70 years old, and you may have been rode hard and hung up wet and had some issues that were traumatic in your life that caused the telomeres to shorten. So we did a clinical study in February of 2017, where we took 25 patients, 13 females, 12 males, with their age variation from 32 years to 77 years. And before we started with the clinical study, we measured their telomere length and we measured their stem cell population. And then we treated them daily for 90 days with stem cell inhalation treatments, and then another 90 days every other day with stem cell inhalation treatments. At the end of the 180 days, we again measured their telomere length and their stem cell population. For the following 6 months, what we did was we treated them every other day with stem cell inhalation treatments. And at the end of that 6 months, which the total was a year, we again measured their stem cell population and their telomere length. We did an analysis of the pre-telomere length and stem cell population as compared to a year later. 38% of the patients that were involved in this clinical study showed an increase in their telomere length and an increase in their stem cell population, which we believe that the telomere is more of a marker as to your age. And we think that the stem cell population in your body actually has more to do with the aging or age reversal or anti-aging if you can increase your stem cell population.
So for people who don't know what a telomere, do not know what a telomere is, can you explain what a telomere is? Because we kind of I jumped into telomeres and stem cells, and I think people might not know what a telomere is. Can you explain what a telomere is?
Yeah, telomere is the end of a chromosome, and the best example I can come up with as to what you would understand a telomere looks like is on the shoelace. The end of the shoelace, there's a little length there that keeps that shoelace from fraying out. The telomere does basically the same thing to a chromosome, and the chromosomes they duplicate and they duplicate and they duplicate during the course of your life, and as they duplicate, it actually causes a shortening of that telomere. So if you can do something in the body to regenerate tissues to slow that process, even though you're regenerating chromosomes, it will allow the telomeres to maintain a length for a longer period of time.
This is another question I have, because this is really interesting subject. Okay, so when your body produces stem cells and they're in your blood, why is it advantageous to pull those stem cells out through through the vein or through the whatever, and then nebulize them? Why can't stem cells just be generated on their own? Why do you collect the stem cells and then have people nebulize them? What is the advantage to that over just saying, hey, I got stem cells in my blood, I don't need to nebulize them?
That's a good question, and there's a two-part answer to that question. The first part of the answer is that what we found out with the clinical studies that we've done is that as you age, you produce less and less stem cells. And also what we found out with the clinical studies that we performed is that by taking the stem cells from the body, reintroducing those stem cells back into the body, there's a stimulation of those stem cells to the body. Not only if the stem cells are going to the pancreas to regenerate beta cells, as an example, to help normalize blood sugar, but by reintroducing those stem cells back into the body, it has actually stimulated the bone marrow to produce more stem cells. And by producing more stem cells, as you are aging from 40 to 50 to 60 to 70, what we saw in the last anti-aging clinical study we did was that even the 3 patients that continued to shorten their telomeres and reduce their stem cell population, the first 6 months, the second 6 months, they actually showed a slowing of the stem cell reduction in population and a slowing of the telomere length. That tells us, or we believe this is a correct hypothesis, is that by reintroducing stem cells back into the body, not only do you give the body a concentrated group of stem cells that can go to the areas that need regeneration, but it also stimulates the bone marrow to actually produce more stem cells. And by producing more stem cells and increasing the stem cell population, you have more stem cells in your body to go through the regenerative processes that need to be taken care of even as you turn 60 and 70 and 80 from 40 down, when just stem cell population starts reducing.
So I have another question. I hope my questions aren't stupid, because I am not a doctor. But okay, like let's say you take out the stem cells, the blood of the person. So is there some kind of procedure that collects the stem cells, that separates them from the blood plasma and the other things that are in the blood?
That's a good question. We have developed a methodology whereby we can pull stem cells out of whole blood. We call this autogenous biologic serum, and it's stem-based, and the methodology that we use is determined by an algorithm that we came up with to extrapolate stem cells by their molecular weight. And we developed a methodology on the angle on how we extrapolate the stem cells, as well as the speed and the time that we utilize to extrapolate the stem cells. And as such, we have coined the term and utilized the term autogenous biologic serum.
So, Dr. Taylor, is this procedure patented?
We have a patent pending at the moment, but we've already filed the initial papers for the patent in this procedure.
Okay. And Dr. Taylor, here's another question. What conditions can be treated with the patient's own stem cells, and how do these stem cells work?
That's a very good question. If you remember, we've completed 72 clinical studies on 72 different conditions utilizing the patient's own stem cells. And I'm sure we don't have time to talk about all 72 conditions, but let's talk about a few conditions and how adult stem cells can alleviate those conditions. Let's start with neuropathy. Neuropathy can and is broken down into a number of different categories. So let's just start with peripheral neuropathy. Peripheral neuropathy is a condition affecting the nerves of the peripheral nervous system. And peripheral nerves means nerves beyond the brain and spinal cord. So damage to peripheral nerves may impair sensation or movement, gland or organ function, depending on which nerves are affected. And in short, neuropathy can and does affect motor, sensory, and autonomic nerves, and as such results in a number of different symptoms. All of them painful and uncomfortable, and at times unbearable to live with. You can attest to that if you've ever had to deal with neuropathy. Common causes of neuropathy include systemic diseases such as diabetes, as well as outside influences like chemotherapy, radiation, vitamin deficiency, medications, antibiotics, traumatic injury, just to name a few. Symptoms of neuropathy include, but are not limited to, painful cramps and fasciculations, which are fine muscle twitching, muscle loss, bone degeneration, and changes in the skin, hair, and nails. Additionally, motor neuropathy may cause impaired balance and coordination. Sensory neuropathy may cause numbness in touch and vibration, and reduced position sense, causing poor coordination and balance. Reduced sensitivity to temperature change and pain. Spontaneous tingling or burning pain, or skin allodynia, which is severe pain just from normally non-painful stimuli such as a light touch. If you know anyone who's had neuropathy, you can just touch them sometimes and it feels like severe burning and like you're sticking an iron to them. Autonomic neuropathy produces diverse symptoms depending on the affected glands or organs, but common symptoms are poor bladder control and abnormal blood pressure or heart rate, and reduced ability to even sweat normally. So, I'm sure the listeners that have dealt with neuropathy, these symptoms sound familiar to them. So this is how we believe that utilizing your own stem cells will reduce and alleviate the symptoms of the neuropathy. Let me preface by saying that in our research studies utilizing patients' own stem cells, what we have found is that the two tissues in the human body that are slower to regenerate than any of the others are nerve and kidney tissue. Now, having said that, we have found that by harvesting the patient's stem cells and then reintroducing those stem cells back into the patient, we have reduced and are alleviated a number of cases of neuropathy. And the way that we go about this procedure is a patent pending methodology that we developed, as we mentioned earlier, whereby we take 2 milliliters of the patient's stem cells and mix it with 2 milliliters of albuterol or saline solution, mix them in a nebulizer. And the patient then undergoes a 15-minute inhalation treatment where the patient breathes the stem cells from the nebulizer into the nose, mouth, and lungs. And then these stem cells also travel through the blood-brain barrier. Let me talk about the blood-brain barrier for a moment. The blood-brain barrier is a highly selective semi-permeable border that separates the circulating blood of the brain and extracellular fluid in the central nervous system. It acts like a protective covering, if you will, for the central nervous system. So the blood-brain barrier restricts the passage of pathogens and diffusion of solutes in the blood in large or hydrophilic molecules into the cerebral spinal fluid. And at the same time, it allows the diffusion of hydrophobic molecules such as oxygen and carbon dioxide and hormones and small polar molecules to enter into the central nervous system to do what they need to do while they're there. Through this inhalation therapy that we talked about, the stem cells not only go into the lungs and then pass through the pulmonary system and then into the circulatory system, but they also pass through the blood-brain barrier into the central nervous system. This regenerates the brain, the spinal cord, the spinal nerves, and all nerve tissues inside the walls of the blood-brain barrier, which in turn affects the regenerative processes of the peripheral nerves. Now, as the nerve tissue is regenerated in the central nervous system, the other stem cells that pass through the pulmonary system into the circulatory system, into the tissue of the body, also begin to regenerate. They also begin a regenerative process in those cells, tissues, and organs. And as such, the stem cells carry on a regenerative process both inside the central nervous system and outside the tissues and organs that are being affected by the neuropathy. So as the irritability and inflammation process of neuropathy is reduced, there's a less irritability and inflammation on the peripheral nerves, and subsequently, with less irritability and inflammation comes less pain and discomfort, and reduction of the symptomatology of the condition that we refer to as neuropathy is dissipated.
You know, you talk about neuropathy. When I was really, really sick with mycoplasma, I couldn't be touched. The sheets in the bed hurt. If you touched me, I'd scream. So I can fully relate to what you just said about neuropathy. And mycoplasma, as far as I've learned, attacks the myelin sheath, which causes neuropathy. Mycoplasma also is the cause of carpal tunnel. Now we're going to talk about diabetes, and Dr. Taylor is going to explain the difference between type 1 and type 2 diabetes and how stem cell therapy helps diabetics.
Diabetes mellitus is commonly known as diabetes, is a group of metabolic disorders that's characterized by high blood sugar levels over a prolonged period of time. Diabetes can and does cause many complications, a number of them both severe and life-threatening. Serious long-term complications regarding diabetes include but are not limited to cardiovascular disease, stroke, chronic kidney disease, foot ulcers that are difficult and sometimes impossible to heal, damage to nerves, damage to the eyes, just to name a few. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin being produced. And there, like we said, there was two types of diabetes, type 1 diabetes and type 2 diabetes. So let's talk about type 1 diabetes for a moment. Type 1 diabetes results from the pancreas failure to produce enough insulin due to the loss of beta cells. Now, beta cells are cells in the pancreas that produce the insulin. And this form of diabetes was previously referred to as insulin-dependent diabetes mellitus, or IDDM, or juvenile diabetes. And scientists tell us that the loss of beta cells in the pancreas is caused by an autoimmune response. Scientists also tell us that the cause of autoimmune response is unknown. So scientists call this idiopathic. And idiopathic is a word that's derived from two Greek words, pathos meaning pathogen or disease, and idio meaning fool or idiot. So idiopathic means the idiot doesn't know what causes the disease. So that, to me, idiopathic is just an excuse for not knowing. But having said that, now that we know that what causes type 1 diabetes is a lack of beta cells in the pancreas, and we know that the loss of beta cells is caused by an autoimmune response, but we don't know what causes the autoimmune response or cause the reduction of the beta cells of the pancreas. So if we only had a way to regenerate beta cells in the pancreas, then we could do something about regulating blood sugar. But there is a way to regenerate beta cells in the pancreas, and that's through stem cells that the body produces. So this is what we found in 19 years of stem cell research. By harvesting stem cells, and we harvest these stem cells from the blood, and then we reintroduce those stem cells back into the person's body by way of the inhalation therapy through the blood-brain barrier and the pulmonary system, which in turn the stem cells travel through the circulatory system. These stem cells arrive as what is referred to as undifferentiated cells, or another name of the cells is neutral cells. They haven't morphed into any particular cell, but they have the DNA matrix to regenerate into any cell that the body needs. So once at the pancreas, what these stem cells do is they differentiate into beta cells. And over a period of treatments of stem cell introduction, there's an accumulation of enough stem cells at the pancreas that differentiate into beta cells, that enough insulin is now being produced that what once was high blood sugar normalizes to the normal between 70 to 110 mg of sugar. And what is considered normal blood sugar levels in the patient is in the spectrum of between 70 to 110, 120. With type 2 diabetes, the patient's dealing with insulin resistance, and that's a condition wherein the cells fail to respond to insulin properly. It takes longer with type 2 diabetes to normalize with stem cell therapeutics than with type 1, but the outcome is the same. And taking the time to utilize stem cell therapeutics, utilizing the patient's stem cells, after a certain amount of time, enough beta cells will be produced in the pancreas that the resistance to insulin will dissipate and the pancreas will function properly and the patient's blood sugar will normalize. So neuropathy and diabetes are two primary examples of conditions that utilizing the patient's stem cells has and can reduce the symptoms and alleviate the conditions altogether.
You know, many of my listeners know that mycoplasma attack degenerative tissue, so it makes me wonder that these beta cells in the pancreas are being attacked by mycoplasma, because all mycoplasma diseases are usually referred to as autoimmune. Your body is attacking itself. It was just the most ridiculous statement that the pharmaceuticals have tried to pull over on us. Your body's attacking itself, so your immune system is attacking itself, so we have to shut off your immune system with steroids. It's just really a shame that the pharmaceuticals are doing this to the world. Now, one of the last questions coming up is, can stem cell therapy affect anti-aging?
I will say with reservation that stem cells may not be the panacea for any and all conditions. Stem cells, even though they regenerate all the tissues in the body, still need some help with other adjuncts. Moreover, stem cells need less interference to do what they need to do what they're properly expected to do. And that's where I believe that adjuncts come in to assist stem cells in their regenerative process. As an example, it would be colloidal silver IV therapies that we use with our patients in Mexico. Silver and most silver compounds have an oligodynamic effect, which is a kind of a sterilizing effect, and are toxic for bacteria and algae and fungi, not only in vitro but particularly in the human organism. So the effectiveness of silver is based on the ability of the biologically silver ions to irreversibly damage key enzymes systems in the cell membranes of pathogens. And when you irreversibly damage those membranes, then those pathogens have no other alternative but to die. And I might say that colloidal silver IVs do this quite well. This is something that in many cases antibiotics and steroids cannot do because of pathogenic resistance that's been built up from continued exposure to the antibiotics and steroids over the years of use. Also, mycoplasma doesn't have a cell wall, and without a molecular membrane, they are more resistant to steroids and to antibiotic therapy. So we believe that the accumulation of mycoplasma in the human body is a major contributing factor to inflammatory processes and inflammation of tissues, organs, and systems, which plays a major part in augmenting the process and progression of normal tissue and organ function into a state of abnormal tissue and organ function. So we also further believe that with colloidal silver therapeutics, a kill-off of this mycoplasma in the body results in a reduction of infection and inflammation, and also serves as a major adjunct to tissue and organ regeneration when conjugated with stem cell therapeutics. And I may be chasing a rabbit at the moment because I was going to talk about anti-aging. But approximately 4 years ago, Stanford University conducted a clinical study whereby they correlated a patient's telomere length to the patient's age. Now, telomeres are the tip ends of chromosomes. I think we talked about that earlier. And as the chromosomes divide and divide and divide, the telomeres become shorter and shorter and shorter. As an example, you may be 70 years old, but your telomeres say that you're only 60, which is really good. Or you may be 70 years old and your telomeres say that you're 80, which is a really good sign that you've probably been rode hard and hung up wet, or you've had some other issues that were traumatic, either physical or chemical and medical, that have caused this shortening of your telomeres. Nevertheless, in February 2018, we performed a human clinical, actually it was February 2017, we performed a human clinical study whereby we took 25 patients, 13 females and 12 males, ranging in age from 32 to 77 years in age, and we measured their stem cell population and their telomere length. And then we harvested their stem cells, and for 90 days, these patients performed a 15-minute stem cell inhalation treatment utilizing their own stem cells every day. At the end of the 90 days, the patients performed their stem cell inhalation treatments every other day for an additional 90 days. At the end of the 6 months, or 180 days, we measured their telomere length and their stem cell population again. And again, for another 180 days, or 6 months, these patients performed their stem cell treatments for 15 minutes every other day. So at the end of the 12-month study, or 360 days, we again measured the patient's stem cell population and the patient's telomere length and correlated our findings. Our results revealed that 38% of the participants' stem cell population increased in number, and their telomeres actually increased in length. So we believe that by increasing the stem cell population in a patient, it is one of the reasons that cells, tissues, and organs can be regenerated more effectively. And by using the telomere as a marker, if we can slow, stop, or actually lengthen a patient's telomere, we believe that we can, to some degree, reverse aging. Now, no one's going to go back to being 13, but if you can reverse aging every year by 2 to 3 years or 4 years, by increasing your stem cell population, you not only can increase your longevity of life, we believe it will also increase the quality of that longevity as well. So there are a number of issues that I think you should consider before you make a decision on whether or not you are considering stem cell therapeutics. I hope we've covered some of these issues with you today, and I hope this time has been beneficial and educational in some regard to stem cells and stem cell therapeutics in the short time that we've had together. I also hope that this time and information can give you a better knowledge and understanding of stem cells and the part they play in the restoration and maintenance of your body's cells, tissues, organs.
So that's the end of this part 1 of Dr. Jim Taylor's interview. And I hope this was educational. I hope all my podcasts are educational. Remember, it's all about information. Do your own research. Look into it. Pretty soon, Dr. Taylor is going to have his website. He's been a very busy person the last years helping other doctors understand how stem cell therapy works. And we're going to go right into the next podcast. We're going to stop this podcast or end this podcast. And I'm so glad again that you've taken the time to come up to St. Louis and let me interview you. It's been a most wonderful experience for me learning about stem cell therapy, because I'm always open to learning, and I hope you are too. So until next time, good night and God bless.